Hi, I'm Dr. Elena Poulos.
I'm Dr. Marnie Fisher, and we're here to talk to you about a very specific, new, exciting endeavor that we are bringing to the clinic. And it is using stem cells from our own hair follicles. So mine, yours potentially. It's so like futuristic and sci-fi.
And just like so exciting,
Yeah.
right? That we can actually now have a very safe and easy, I would say, way of actually harvesting our own stem cells. It's like the ultimate in personalized medicine. And really, we're also interested in longevity. We want to be healthy. We want to live for many years. We want to preserve ourselves as best we can. This is really one of the most exciting innovations and step forward in longevity medicine. So let's start by just the basics. So what is a stem cell? So a stem cell, there's different types of stem cells. They're in our body. They're present in ourselves as embryos. They're present in ourselves as adult humans.
Most of us are probably most familiar with stem cells in the use of the term a stem cell transplant for, say, a leukemic, myelogenic oncology or cancer, where a person needs a stem cell transplant in order to fight their cancer. And those are generally taken from, say, the bone, the bony crest on the hip or something like that. And they can be self or they can be a closely matched. But we're talking about a different kind of a stem cell.
The mesenchymal stem cell that comes from where the hair follicle is. So if you took a little hair and you just plucked it out, and you looked it up, you held it up in the light, you could see that at the base of your hair follicle, there's like a little bulge. That's what we call it. It's that little bulb that you see at the root. And in that bulb, particularly if you're plucking out a healthy hair, you'll see that there's sort of this clear, transparent sheath. And within that sheath is where the stem cell lives. So that stem cell, again, it's almost like the seed, right? It's the origin of all of those future cells.
And that's basically what we're looking at as our gift of life and gift of energy with this process.
So what makes stem cells so special is that they have this ability to self-renew. So it's really one of the only types of cells we have in our body that has this endless ability just to renew. So continually regrowing. And then as some of those cells grow, they can differentiate, meaning turn into different kinds of cells. So some of them will be differentiated, let's say, to actually produce, let's say, the shaft of your hair, whereas others will turn into a cell that's more for the root of the hair. Now let's talk a little bit about the Acorn labs in particular and how we've chosen them for our purposes here as dermatologists. So Acorn is a Canadian-based company, which was started by Dr. Drew Taylor, who actually used to be a professional baseball player, very interestingly.
So he was on his own mission to find a source of stem cells from the body that would be very easily harvested in the hunt to regenerate cartilage. So his personal baby is to regenerate cartilage. And along the way, he discovered that when you take these mesenchymal stem cells from a hair follicle and then you put it in the right cultural mix, it has a growth pattern that is extraordinary. That is so exciting.
It's so exciting.
Yeah.
So let's kind of walk through the process because, of course, Libby and I were super excited to be, again, patient number 1 and 2 here at Kingsway. So the first step is to harvest the stem cells. So this brilliant idea. This is actually, I think, the easiest way to harvest stem cells that I've ever seen. So traditionally in medicine, when stem cells, for example, are used, like you said, for, let's say, a bone marrow transplant, those stem cells are actually derived from the bone marrow, which you can imagine very difficult, very painful. We would never do that for an aesthetic procedure. But in this case, the stem cells are literally just coming from the hair follicle. So we pluck out about 50 hairs. No, it sounds like a lot, but just keep in mind that in a typical day, we're losing about 100 hairs a day. That's like a typical shed for a day. So we come in, we pluck out about 50 hair follicles. And the hairs that we get are really from the back of the hair. So that the hairs that we grow right at the nape of the neck and the posterior scalp are actually a little bit different than the hairs that we grow at the front. So they tend to be hardier. They're less likely to be influenced by hormones or nutritional fluctuations. So they're very hardy. So step one is we harvest the stem cells. So we're plucking out 50 hairs. And then as we're putting them into the culture medium, so it looks almost like a little soup of nutrients, as we're putting them into the culture, they're examined under magnification to make sure that the bulbs are very healthy and that we can see that they're viable. Then all of those little hairs get sent off to the Toronto General Hospital. That's where the Acorn lab is. Then they get examined under microscopy. So within about 24 hours of sending it off, you get a report in your inbox, which is most exciting. So in my case, they were able to isolate out 70,000 stem cells. How many did you get? It was a little bit of a competition, I have to say, here in the clinic.
I didn't look.
You didn't look?
It wasn't a competition.
So within about a day, you get a report coming back as to how many viable cells were in your collection, which is great. So it goes from the collection stage to the growth stage. So your cells then get transferred into a growth medium where they are expanded. So the whole goal is to get a large bulk of your own mesenchymal stem cells. At that point, you have a choice of what you want to do. So for many people, they're just going to stop right there and they're happy enough to have a store of their own stem cells. Why?
Well, the best way to describe this is that we are biologically banking as an insurance policy. Some people feel very strongly with the rate of medical research around the world, with the ability to use some of these stem cells to further their own cartilage growth or to further their aesthetic medicine or their existing joints and tendon repair. And it could be even as far reaching as, say, oncology treatments and oncology medicine.
There's thousands of studies going on worldwide. And although we're not quite there yet, we're certainly getting very, very close to be able to use these stem cells to actually create your own tissue. So just imagine now, right? So you banked your cells when you're healthy. Now, all of a sudden, let's say you're 70, 75 years old and you've destroyed a cartilage in your knee. Well, there's this very likely potential that you'll be able to take your own bank stem cells, send them off to a lab anywhere around the world, get your own cartilage grown, which is bioidentical, identical to yourself, and get this beautiful bioidentical cartilage surgically implanted in your body. So part one would be just to isolate your own stem cells.
Collect your follicles, bank them.
Bank them.
Yeah.
Right? And they can be banked there indefinitely. So they're frozen down in a cryopreservative. They're kept there for as many years as you want to hold on to them.
So then specifically related to hair regeneration, some of those stem cells are then taken out of your own storage and then they are put in the right atmosphere, soup culture, and then they are made to grow very rapidly. And then that is put and harvested into a serum. It is approximately 34 times the concentration of what's available in the tiny little platelet envelope packages that we are using currently for PRP-based hair treatments and PRP-based skin treatments. So it is really densely packed with all of these yummy secretomes and exosomes.
So for example, where we are in the process, so currently I can tell you that my stem cells right now are growing, which is very exciting. And then as soon as sort of that culture has been built up, we'll be able to take those and then switch to a different medium where the secretomes will be created. So those are my own, like our own or the patient's own endogenous exosomes that we're using, and then being able to inject into the scalp or onto the skin to regenerate the tissue. So grow new hair, grow new skin, new collagen, new elastin, and really regenerate all those tissues in a very personalized way.
So the hair program is going to consist of microneedling on the scalp and then the application of the secretomes right on the surface. Remember, exosomes and secretomes, these included, even though your own, they are not injected currently. They are not FDA or Health Canada approved for injections. They are applied through micropores and microchannels.
So why would somebody really choose this type of program for hair as compared to other types of programs? So why use your own mesenchymal stem cells to create your own secretomes compared to another option would be to just get commercially available exosomes? So the benefit would be, so there's a few extra steps obviously involved in harvesting your own stem cells. As far as just looking at hair itself, we do feel that the secretomes that are going to be generated from one's own stem cells compared to exosomes that we're getting commercially, let's say from a bovine source or from synthesized human sources, they're likely going to be more individualized, more personalized. Probably that molecular sequencing and communication is going to be more effective when they're the secretomes derived from your own stem cells compared to from a different source.
And we definitely have seen the data and the research that they are more dense, which is very exciting compared to a commercially available and a self-harvested or autologous PRP as well. So on the realm of 34 times the abundance of secretomes there.
How much is it going to help? So what can I expect the benefit to be? And that is really likely to be one of the hardest questions that we will have to answer. And the reason for this is really multifold. So the first is what you just alluded to, is that it's very difficult to predict as we're plucking out those mesenchymal stem cells whose are going to be better than the next person. So whose stem cells are going to be more active. It's very difficult to predict. So again, in general, we know the younger you are, the healthier, the more viable those cells are. But there's probably just as many exceptions to that, right? Just like we see in the aging process. I mean, I have a patient myself who's 90 years old and she's running marathons, right? So just because you're older doesn't mean that the stem cells are not viable, and then the opposite's true. So there's that.
Yeah, and then also in the longevity sphere, we do know that different organs are aging at different rates of time as well.
Yeah, like we've all seen, for example, 80-year-olds that have fantastic hair, right? And you're just like, wow, I mean, you wouldn't expect it, but it is true that depending on your genetics, your lifestyle, how you grew up, right? Different organs and different parts of the body are going to age in a different way. So there's that part of it. And then the second part of it, which is something that we've become very used to with PRP and PRF treatments that we do, which is that really this is kind of like a biohack. So when we're using secretomes or exosomes, we're really trying to stimulate our own biology. And that really depends on the receptors that we have in our skin cells. It depends on our genetics, our DNA, and not everybody is going to respond the same way. So we can predict that definitely it's going to help, but to be able to know how much of a benefit each individual is going to get is truly going to be a question that will be very difficult to answer.
Very exciting on the horizon. We've got biobanking available here at Kingsway Dermatology. If this is of interest to you, then by all means, leave us comments, give us a phone call. We're excited to get the program started.
It's really the future of regenerative medicine and longevity, right? So very exciting. If you have questions, comments, you're interested, you want more details, drop a note, come on in and visit us even better. We'd love to see you. Thanks so much for watching. I'm Dr. Elena Poulos.
I'm Dr. Marnie Fisher. See you next time.
Bye.